Hi, everyone. My name is Neal. I'm a BAMN organizer based in Detroit. And I'm just going to talk about a couple things today. So hopefully I'll be relatively brief. First, I want to talk about what Shanta mentioned. The big trend we're seeing over this past week is the lifting of mask mandates all over the country, including in very liberal places, liberal California, liberal New York, Michigan, and what is going on with that, and to talk about the health implications and the economic basis of that policy. And the other thing I want to do is something I've kind of avoided because I wanted to have like my doctor or some other doctor on one of these tribunals go over, okay, like what are the health implications of all of these demands that we have? Because you can't just pick and choose from among these demands. Each of them does something different. Vaccines do something different than what masks do, which do something other than what testing does. And you have so many school districts who are just saying, oh, we're doing something, doing something isn't enough. And I want to go through why. But in the absence of my doctor being here, I just want to tell you what he told me when I visited him. And what he told me was, no one should be allowed to not be vaccinated. No one should be allowed to not wear a mask, because that's not just about your health, that's about my health. And he was absolutely emphatic about that, and he was absolutely right. And so eventually, if we can get more of what what a doctor understands about what this crisis means for your health and why these measures are so important, that would be great. But it's definitely overdue for us to be talking about personal safety and including about masks, because I want everyone here on this call to definitely be wearing masks that really protect you and could save your life. So I'm just going to bring up my screen here. Okay, so we have seen a trend all over the country. All the mask mandates are lifting. Here in Michigan, now all mask mandates in schools have been officially lifted. Wayne County, the county that includes Detroit, just became the last one, following Washtenaw and Oakland County lifting mask mandates the day before. And they say, well, we can do this because cases are going down. That is not a very good reason to drop mask mandates. Cases have gone up and down over and over and over again. And every time restrictions are lifted, we get new waves of COVID because we keep seeing an evolving virus that keeps coming back around with new variants. So, I mean, here you have this example of the state of Michigan with a liberal Democratic governor, Governor Whitmer, who was liberal enough that some crazy Trump supporters wanted to kidnap her and do all of that stuff, which you might have seen in the news. But we're seeing both political parties now really gang up on ending these restrictions, in spite of the fact that even the CDC, which has been very lax in its regulations. Even the CDC is saying you should not be dropping these mask mandates. And okay, what is the situation in Michigan? What is so wonderful that they're saying they can drop their mask mandates? Well, nothing's really all that wonderful. Over the last 2 days, Michigan reported close to 6,000 new cases and 152 deaths. So this is not exactly news that should encourage lifting of mask mandates. And all of this flies in the face of the science. Anyone who is telling you that this policy is based on science should remember that everything Donald Trump said and all of Donald Trump's policies, he said his policies were based on science. This is not true. And in fact, there are increasing numbers of studies showing just how effective masks are. And this is in Economist magazine. Real world evidence shows face masks reduce COVID-19 spread. A study from Bangladesh found they help even if many people don't wear them. That was one of the lines that you heard in the early phases of the pandemic, that, oh, masks don't protect you, they protect the other person. No, masks do protect you and provide something very beneficial. And we have more and more and more evidence that that this is something you should really care about. And so in the face of all of this evidence, why are these mandates being lifted? For the same reason that schools are being reopened. It has been discussed very broadly over the course of the entire pandemic. Mask mandates, as well as school closures, threaten economic momentum. When people are required to wear masks to enter business places, they don't go shopping as much. And mask use in general communicates to people, hey, it's unsafe. Maybe you don't want to be risking your life everywhere. You could get infected. And so, just like all of the other measures, wherever public health conflicts with someone making profit, our leaders in both political parties will choose profit over public health. And that's absolutely consistent. And we are not the only people pointing this out. Here in foreignpolicy.com, economists are fueling the war against public health. New report is being hailed by conservatives, but doesn't stand up to scrutiny. There's a lot of quack science and statistical manipulation being tossed around by conservatives now in order to justify, basically doing nothing for public health and in fact risking public health for the sake of the economy. And this is something we talked about last time, and we'll be talking about this over and over. So I'm not going to spend too long on this point, but I do want to raise something that that is a problem with these lack of regulations, which is that the masks themselves aren't necessarily all that well regulated. They are all produced by private companies, and you don't always know if you're getting a real N95 or a real KN95. And there's a lot of counterfeits. The easiest place to find counterfeits is on Amazon. And you really should not be getting your masks from Amazon. Even if it says Amazon Choice. Amazon is the perfect marketplace for selling frauds. And so it can be very hard to know what what masks actually meet the 95% standard and what ones don't. And because none of this is actually regulated by the government, and it's very easy to sell something that doesn't work, it's hard to know what to get. Now, the government is giving people 4 free N95 masks. Those masks are independently validated to be, genuine N95 masks that do protect you, and they are in fact, better than 95%. However, you only get 4 of them. So, 4 days of protection is not enough. And we should be getting a lot more than 4 masks. There have been lots of independent testing. Here's a list of tests done by the so-called mask nerd. And he just went through and did his own independent testing of how much particles get through various KF94s, N95s, KN95s, cloth masks, tested dozens and dozens of masks, and there's all kinds of other independent testing. A good place, one of the better places that New York Times and other people have reported on for getting genuine masks is called Project N95, which is a nonprofit group. And they have gone out of the way to make sure that the masks that are offered through them are actually genuine. But this is still expensive for a lot of people, especially the better masks, which people should have, which are N95s, KN95s, and KF94s. Some of them are, significantly better than, 95% at filtering out particles. You can get close to 98, 99% effectiveness. And those masks should be available to everybody, free of charge. I have, just a couple masks here. This one is KN95. This one is N95. That can be difficult to tell apart at a glance, but N95 should have the NIOSH, N-I-O-S-H printed on it, but to announce that it is certified to be an N95. But the problem is, with that certification, anybody can print that on a mask. Just saying NIOSH is not the safest indicator that you're getting something real. So for your own personal safety, I definitely recommend do not get your masks on Amazon. Get them from, doesn't have to be Project N95, but get something that is certified or at least tested. I think what the government is sending out is the 3M brand, which has been independently tested to be very good. But there's lots of stuff out there, and it's just something that should be available to everyone free of charge. Okay, so let's talk about our demands and what are the medical implications for all of these, and what do each of these mean for your safety? And so I'm actually going to compare each of these to another kind of safety, and I apologize that this is kind of corny, but let's compare this range of demands to all of the different safety measures that we are used to with driving safety, because we are used to having many different rules that we have to follow and many different safety measures. I'm going to start with the second thing on our list, which is vaccinations. They should be mandatory. Vaccines are especially valuable for keeping you out of the hospital and keeping you from being dead if you happen to be infected with COVID. And in fact, it's one of the single most effective measures for reducing the body count is if you get everybody vaccinated. Healthcare professionals are going to emphasize this demand first and foremost, especially people who work in hospitals, because the overwhelming majority of what they are dealing with in hospitals, with hospitalizations and deaths, could have been prevented by just this one measure. But this isn't enough by itself. While the vaccines offer very good protection against hospitalization and death, they don't offer as much protection when it comes to getting infected in the first place. And especially with every new variant, there are many more breakthrough infections. And one of the things that confuses people about vaccines is they say, oh, protection keeps going down over time. And the thing is, the immune system is really complicated, and immunology is one of the most complicated subjects I have ever looked into, and it's one of the reasons why I would really like to have, my doctor, talking to the people here. But your immune system has so many different tools. It has antibodies which are ready and waiting to neutralize a pathogen when it enters your body. You have memory B cells which are ready to produce new antibodies when they because they remember what the pathogen is and what's the correct antibody. You have T cells which go around your body and destroy infected cells, and what we've seen with not just the COVID-19 vaccinations, but with lots of types of vaccinations is a while after getting vaccinated, antibody protection will go down. And if you want to keep that up to date, then you need to get a booster every so often. Just like you have to get a yearly flu shot, you need to get boosted for COVID at regular periods. But the basic protection of your T cells understanding how to fight off the infection and your memory B cells functioning continues to be quite good. So in a situation where, okay, you can still get infected, but you have a strong level of protection against severe consequences, it would be useful to think of being vaccinated as being like wearing a seatbelt and having an airbag in your car. If you get into an accident, it makes you a lot less likely to die. But it doesn't necessarily prevent you from getting in an accident. So you're going to need other things. Mask use is one of those things to keep you from getting in the accident. Following the basic rules of the road, don't drive on the wrong side of the streets, stop at red lights. I am vaccinated against tetanus, but that does not mean that I am about to be stabbing myself with rusted metal and exposing myself to tetanus. That doesn't make sense. That doesn't sound safe. If you are vaccinated against COVID-19, that doesn't mean you want to be going around and breathing in lots of COVID-19. That doesn't make sense. You're tempting fate. And just because you are wearing a seatbelt in a car and you have a good airbag doesn't mean it's totally fine to go around getting into lots of accidents. Well, not only can that cause you lots of problems, but you still run the risk of something really bad happening to you, including death. The complete nonsense of what the CDC did after the alpha variant started declining. The CDC said, "Oh, if you're vaccinated, you don't need to wear masks anymore." That is like saying, if you are wearing a seatbelt, you don't need to follow the rules of the road anymore. That's how crazy that is. You can go and get in as many accidents as you want, and vice versa. If you're wearing a mask but not vaccinated, it's like saying, "Oh, if you drive really carefully and you follow the rules of the road, you don't need to wear your seatbelt anymore." That's nonsense. Mandatory PCR testing. Are you safe to drive? This is like being able to test someone's blood alcohol level, with the breathalyzer. Can you see? If you can't see 5 feet in front of you, you probably shouldn't be driving. You probably shouldn't have a license. You're going to get yourself killed and probably somebody else killed. Testing is important. But obviously this isn't the same thing as vaccinations or masks. When the Biden administration put forward its so-called vaccine mandates, which was shot down by the Supreme Court, it wasn't really a vaccine mandate. It was a vaccine or test mandate. Those aren't the same thing, and one does not replace the other. In driving safety, it's like saying, "Oh, if you have a license and you can see and you understand the rules of the road, you don't need to wear your seatbelt." Or conversely, if you have a seatbelt and airbags and safety measures in your car, doesn't matter if you can't see, doesn't matter if you're drunk, go ahead. This is nonsensical. In the world of driving, which, okay, there's lots of traffic fatalities every year, but nowhere near the number of fatalities that we're seeing from COVID. It doesn't make sense to treat these policies as interchangeable. The demand that we have gathered to talk about shutting down in-person schools immediately. This has also applied in cases of bad driving conditions. Here in Michigan, we have this thing called snow days. When there's lots of snow and ice on the ground, that can cause a lot of traffic accidents, and schools do not want to have an entire busload of students get in some traffic accident on the way to school, and so they shut schools down. There are times when the weather is bad enough that it isn't safe to be traveling to and from school. Well, we are in a situation that is much more dangerous than having snow and ice on the roads. We are in a deadly pandemic. So more than just having a busload of students that could get in a traffic accident due to the ice, when you get in a COVID accident, it's the accident that keeps on going, because one accident leads to many, many more accidents. One infection keeps spreading to more and more people. That's very different than a traffic accident. That's more than just a pileup, which remains in one location. When it comes to COVID accidents and COVID infections, it keeps spreading and spreading and going to more and more places and infecting thousands of people. So that makes it all the more important to be containing that possibility. If it is, generally accepted as reasonable to shut down a school because of some snow falling, it should be even more reasonable to shut them down when there's a deadly pandemic going around. Let's see, 1, 2, 3, 4, fifth demand, expanding paid leave and economic assistance. As was pointed out before, but uh, uh, in one of the studies we showed, and I'll just go to that, this was talked about recently, but the impact of non-pharmaceutical interventions on COVID transmission across 130 countries and territories. This study of 130 countries found that there was strong evidence for an association between two non-pharmaceutical interventions, school closure and internal movement restrictions, and reduced rate of transmission. And other three non-pharmaceutical interventions, workplace closure, income support, and debt and contract relief, had strong evidence of effectiveness even when ignoring their level of intensity. So if you just provide people with economic assistance, paid leave, that by itself has its own positive effect on health and well-being. It means parents can stay home and assist their children's education. So yes, paid leave and economic assistance are a public health demand. And this is a kind of assistance people need in all types of situations, and including transportation situations. People, not everybody can drive. You need public transportation. I want to. The real reason I want to use this driving analogy is for this last point, though, because I have something important that I want to say about this. And the racist second-class treatment of minority and immigrant communities, full resources and rights to healthcare regardless of documentation or status. This pandemic is disproportionately harming Black and Latino inner city communities in this country, and places a special burden on undocumented people who have the least ability to stay home from work, who are being exploited by businesses, essentially using undocumented people as sweatshop laborers, and have very little ability to take most of these measures into their own hands. And you may ask, well, why do you want to make a driving analogy around this? Because one of the things that if you're Black or Latino in this country, you know of a phenomenon called driving while Black, and a phenomenon where you are much more likely to be victimized by police, by authority figures. You can be pulled over, abused, you can be shot. And this is something we've had civil rights demonstrations on around the George Floyd protests, the police abuse of Black and Latino communities. The reason I want to make that analogy is because Black and Latino communities in this country understand better than anybody else. Sometimes the people who are supposed to be keeping you safe are the people who are getting you killed. And that is what is happening in this pandemic. The people who are supposed to be keeping you safe, the politicians, the public health figures, your school administrators, are the people exposing you to danger and the people putting your life on the line. That is what's happening here. That is why we have the responsibility of making these public health demands in the first place, because the people who should be responsible for doing these themselves are not, and they are not going to do them unless they are forced to by a power greater than them, and that is why we have to build a mass movement. You know, it is completely reckless and irresponsible to treat human lives this way. And it is especially reprehensible to be doing this to school children. We completely accept the fact that, okay, what is one of the zones where you're supposed to drive slowly and they reduce the speed limit? It's around schools. Why? Because we have a basic human instinct to, you know, care more about children. This is something important to us. It is beyond reprehensible that school administrators, local political officials, governors, and even the executive branch and the president would be willing to put so many children in harm's way simply for the benefit of a few rich people getting richer. It's completely unacceptable. And, you know, and I think there's a growing consciousness of just how badly betrayed the American people have been when it comes to this pandemic. We have well over 900,000 deaths. We are speeding towards 1 million deaths, which were overwhelmingly preventable deaths. And the people who could have prevented it, knew how to prevent it, had any number of scientists giving them the science to understand what are the best ways to prevent that kind of catastrophe. They chose not to prevent it, and they chose for death. And, you know, that is why it's so important for us to be building a new generation of leaders fighting for the real future, and fighting for the people who are really going to need to be the new leaders of this country and the new leaders of this world. The high school students and the young people of today who are leading walkouts around the country. That is our hope for the future. And so I'd like to turn things back over to Yvette and Shanta to talk about how do we build that struggle that we need most.